I've got a local friend with me today. It's Dede Montgomery. She's an industrial hygienist, and she's also the senior research associate at the Oregon Institute of Occupational Health Sciences. Dede, thank you so much. Thanks for coming on, and how are you doing today?
Thanks, Jeff. I'm great. It's Friday, and I'm glad to see you.
Yeah, me too. Yeah, happy Friday to you. All right, could you give people a little heads up about what we're going to be talking about, and maybe talk a little bit kind of who you are, what you do, and tell us more about the Oregon Institute of Occupational Health Sciences?
You bet, Jeff. So we're going to talk about sleep deprivation, fatigue today. As Jeff mentioned, I'm a senior research associate at the Oregon Institute of Occupational Health Sciences. We have a long name. And sometimes we call ourselves Occ Health Sci or the Institute, but we are based at OHSU in Portland, and we are, funded to do research around occupational safety and health, well-being. Some of you know it around total worker health. And so we do research from basic and applied through education and outreach. And I kind of lead up our education and outreach side of things. So many of you see me at conferences, and I've seen Jeff a number of times, and really enjoyed kind of translating what we're learning from the research side into usable tools and toolkits and things we can share with employers and employees. Within the Institute is housed the Oregon Healthy Workforce Center, which some of you know is one of 6 centers of excellence funded by NIOSH, the National Institute of Occupational Safety and Health, to do work, to do research and outreach on total worker health, which I think will be something that maybe Jeff will talk about at a later date. Although I would say that total worker health really will wind up coming up in our talk today, as it's so related to the topic. Or rather, you could say the topic is so related to total worker health. My own background, I was trained as an industrial hygienist a whole bunch of years ago, and I've worked probably more than 30 years in the field, kind of from traditional safety and health and industrial hygiene to really more recently in the last 15 or 16 years since I've been here at OHSU, around kind of really expanding, looking beyond what we traditionally thought of as safety into factors that affect safety and affect occupational health, but also relate to well-being. And that's really that kind of total worker health topic that I referred to earlier.
All right, great. Yeah, I'd love to have you back to talk about total worker health. We have a NIOSH representative coming to talk at it soon, and I'd love to talk with you about that after that. You're right, I have been to conferences, I've seen you speaking on total worker health, and I've seen people pouring out of the room really after with a lot of positive feedback. So we'd love to have you back on that. I guess today we're going to talk about a couple things, fatigue and sleep deprivation, and I wonder if you could tell us what those two things are and how they're related.
You bet. For most of us, I think we know what fatigue is. It's the tiredness. It's either because we haven't gotten enough sleep or physically we're just exhausted. And when we're just physically exhausted, then resting, being sedentary, that can help us feel better. I'm really focusing more on the type of fatigue that comes from not getting enough sleep. We might call that sleep deficiency. And it's either because we're literally not sleeping enough or the quality of our sleep isn't very good, which can have a similar effect. And so although being physically active can interact with that, right? Sometimes when we're really physically active, we need more sleep. What I find, and when I talk with a lot of people on this, many of us are just really aware of the fact that most of us don't get enough sleep, whether it's because we have a sleep disorder and we're just not able to sleep, or more commonly, we're not taking the time or getting the time to get in the hours like we should.
Great. So you mentioned that most of us feel that way. I wonder if you have any statistics about like what kind of percentage of Americans we're talking about who are suffering from some form of sleep deprivation, and maybe some ideas of why that is.
You bet. So there's different kind of approximations out there. most people would agree that about 30% of the average adult, US adult, is not getting enough sleep. So basically, or getting really less than 7 hours a night. And it's really interesting because they've compared how much sleep we get today as compared to 50 years ago. So the average adult today gets about 6.9 hours of sleep a night, whereas 50 years ago, I think we were looking at about 8.5 hours.
Oh,
So
wow.
that's pretty substantial, and I think we can all think of, and we'll talk about some of the reasons as to why that is. But before we do that, I think we also need to think about, now that was average adult. I think if you narrowed it down and looked at working adults, the working adults are going to probably tend to have higher percentages of people not getting enough sleep. And if you narrow that even further to just say people who work alternative shifts or specifically night shift, the CDC, it's a little bit of an older data, but I would imagine it's still pretty true, is that up to 44% of night shift workers are getting less than or equal to 6 hours of sleep on an average 24-hour block.
Wow.
So that's less than what we know is true for, the advice is for most healthy adults, you need between 7 and 9 hours of sleep. And maybe we've even been the one who've said, no, not me. I only need 5. I can get by on 4, whatever. And, if you talk to any sleep researchers, they would pretty much disagree with that. It's just really, most people really do need between that 7 and 8 to up to 9 hours to really feel good, to feel right.
I'm glad you
So,
called that last point out. In learning, I'm a learning professional. A lot of people really don't know. They can't evaluate their own learning, and I think that's a good example as well, where people really can't evaluate what the appropriate amount of sleep is too. Or like, oh yeah, I could multitask. There's a lot of lack of self-awareness in general, isn't there?
there is, and we talk about that, just in terms of one of we'll get to this, but just while you brought it up, in the workplace, we aren't good judges of how sleepy or not, how well we're doing. And that's where, in a workplace where we feel safe talking to each other and, calling people out, in a positive, safe, and respectful way that, hey, maybe today's not a good day for you to do that, as an example. So I think that's a really good point, Jeff.
Yeah, it's and I don't want to take you off track. Those are pretty amazing statistics. The thing about 50 years was interesting because I imagine if you took that back to before our houses were wired with electrical lighting and stuff, there'd be a greater difference.
Sure, yeah. And so you had asked, well, why is that? Well,
Yeah.
there's all kinds of reasons. It's how much we're working. It's maybe multiple jobs. It's when we're working. So, and then it's certainly all the opportunities. When I was a kid, I'm not that old, but when I was a kid, there was no shopping on Sunday, right? There were no computers. The TV there was nothing on after a certain time of night, and we didn't have cell phones. And so all those things have, changed our opportunities to just keep our brain going or keep our bodies going.
So if it's true that maybe life seems busier and we have more things to do, and if it's true that we have more distractions like our cell phone at our bedside, are there also some physical issues involved in this as well, especially in terms of quality of sleep?
Oh, for sure. Yeah. I think that's what you're asking.
Yeah.
So,
Yeah.
when we talk about not getting enough sleep, part of it is literally not having the hours, right? Which we know when you don't, and we can all, I'm sure, think of times, whether we've been traveling and we've only had a little bit or whatever it might be. There are certain things your body just doesn't do well when that's happened. But there's also a lot of research looking at what we kind of call that circadian rhythm misalignment. So you're basically not sleeping at the time that your body thinks you should, or really it's kind of inappropriately timed sleep and wake cycles as compared to what the natural world around us is doing. And so that can start to get, especially when we're, mixing and matching. You think the best example, or really the worst example, are people who work, rotating work shifts and are frequently rotating. their bodies, their brain sees the sunlight at certain times a day, but it's not matched with when their brain thinks they should be sleeping. And then within that, our circadian rhythm is it's amazing, where each organ has kind of its own rhythm, and they get misaligned throughout our bodies. And that's really where we believe kind of the disease and the risk, kind of really the risk exists for health conditions, adverse health conditions as related to that.
All right, guys, that leads into my next question then. So we've got a lot of people out there who are suffering from sleep deprivation. There are a lot of reasons for it, including the stuff you talked about. I imagine things like sleep apnea as well. What are the bad consequences? Why should I care? What are the bad consequences of it?
Yeah, and so you're right. I didn't really mention what you were starting to ask. Sleep apnea, right? A lot of people are affected by sleep apnea. We'll talk a little more later about what organizations and people can do to get on that, because sleep apnea, you're not even aware of how many times you're waking up throughout the night or stop breathing, which causes you to wake up. Other things, insomnia and restless leg syndrome. There's lots of definitely those things. But the consequences, we know affect virtually every system of the body, or every, our metabolic, cardiovascular systems, we know, memory, which we've probably all experienced, immune function. We know that our body heals itself, or at least healing takes place when we're getting certain types of good sleep. Reproductive hazard or reproductive issues, cognitive issues. There's certainly been some look at sleep disruption over longer periods of time, and potentially linkages with dementia. And I think there's some recent research that's kind of interesting, looking at increased inflammation related to not enough sleep or not quality sleep. And so I think it's really fair to say there's the whole health piece, but on top of that, certainly traditionally in safety, we've always been aware of the safety risk, right. The error rates, that we make when we're not thinking clearly. Our memory's not as good, our reaction times, right? Sadly, people can probably think about a time they've been driving and they've caught themselves almost falling asleep, and that reaction time and that increased risk of an incident or accident, whether driving or handling other equipment, and certainly those safety sensitive jobs are particularly at risk there, as well as you imagine like in nursing, where we have errors that can affect patient outcomes, or other people that we come in contact with. So there's the alertness. And then, of course, there's mood, right? Mood is huge. I think it's always interesting for me to talk to someone who has had a history of apnea, and then they've had it treated, whether using a CPAP or whatever they're using. And they will always say, I had no idea I was feeling so bad until that point when I saw I could feel good. And, when we don't have enough sleep, we sometimes are not very nice human beings, right? I mean, we can kind of be irritable. We're quick to judge. And I sometimes think about how if we have had children in our lives or been around children, and our kids would get cranky, our first thing would be, you need a nap. And, it's kind of true with us. So there's just so many things related to that. And talking about kids, and this isn't really an area of research we do, but I think it's interesting. There have been some looking at the number of children that probably don't get enough sleep, and relating that to maybe diagnoses that have been made on learning disabilities that are maybe somewhat or entirely related to simply not having had enough sleep to be prepared to be a learner.
Yeah, I can see that. All right, so if those are some psychological and physical problems for mostly for individuals related to sleep deprivation, you kind of created at least one bridge to my next question is, and that was by discussing error rates at work and so on. But what are some issues that an organization might be bad factors for the organization, and some reasons why they would be concerned about this?
Yeah, I think that's a great question, and we could really broaden that. As we talk about total worker health, we're recognizing that the way I am outside of work comes back to me when I come to work, right?
Mm-hmm.
So with sleep or sleep deficiency, if I am having health symptoms or negative health consequences, that might take me away from my job. So that's a cost to the organization. So whatever it is that's taking me away from my job is a cost to the organization, because they're either going to find someone to replace me, which costs, or what we're seeing a lot today is more people. We're not going to hire more people, but those people there have to work more to do what I'm not doing. So that's just kind of a basic piece.
Sure.
On top of that, we talked about the mood,
Mm-hmm.
and we've talked about the errors. And I think, those are all the things that really it should make an employer, I think, be very aware of and concerned about it. And the one piece is, well, I can't control someone's personal health, right? That might be an employer's feeling. Although there's lots that's going in on education, because we recognize as we offer opportunities for people to be healthier without making them mandatory, that can increase how someone's well-being, which increases their productivity and their staying power in a job. But on top of that, the bigger thing with organizations is, what are we doing within our organization that is taking our people away from getting sleep, right?
Yeah.
And we can kind of jump right into that. I think, let's think about it. And this comes up a lot in the classes I teach. These are, and we'll talk in a minute, these things that you can do personally, to get more sleep. And that's all well and good. But what if you're working a 12 to maybe now a 14-hour work shift? You're driving home before and after, which puts you at a risk just from an accident, which is certainly something else employers should worry about.
Mm-hmm.
But on top of that, because of what's going on within my organization, maybe tomorrow I'm rotating to a different shift, or because I'm not making enough money in this job, I have a second job, or I have a third job. And those consequences are all going to have an impact on if I can have sleep, if I'm going to have time to exercise, if I have time with my family, which helps recharge me to be able to be better at work again. It's kind of like that vicious cycle. And
It makes sense that you're talking about obvious things like days away from work, and you're talking about the replacement cost of that temporarily gone worker, and you're talking about incident rates. But outside, I don't know that people talk about this so much in safety and health, but outside of safety and health, one of the massive buzzwords you can't get away from is engagement. And you were talking about moods, and I can't imagine if you have somebody who's sleep deprived, that's the most engaged worker. I would imagine that affects things like, as you mentioned, productivity, even innovation, efficiency, and ultimately seems like it would have to have a drag on retention as well. So now you're going to have to spend more hiring new people and training them up.
Yeah, absolutely. And sometimes the term is used, presenteeism, which I'm sure you've heard of, which kind of means I'm there, but I'm not there. And in older days, I think we would use that more commonly when maybe I had a chronic health condition where I'm really, because I'm in pain, or there's a health thing going on where I'm really not there. But commonly now we use it to really relate to many things that make me not really be as I could be when I'm trying to be, at work, engaged. And engagement is huge. And engagement is a big deal too with thinking for solutions around this topic.
Right.
And it's like what we've always said in safety, which is, who knows the most about any job? the person that does it. So
Right.
if we're not trying to engage them in the conversation about how we could do it better, we're going to do two things. We're going to maybe miss the boat on what could be helpful, but we're also going to lose their trust in us
Mm-hmm.
because they're not, because you're not going to even ask me, or you might ask me, but then you don't do it. So we know that those top companies that, you said that are keeping people longer, which is huge in today's market, right? Not just the
Mm-hmm.
cost, but
Mm-hmm.
finding workers, training, retraining, getting that kind of commitment. So there's that. And then I think the other piece that we kind of need to think about is, and it can come up later too, but a big thing that I think employers don't think about is with that education piece, helping offer, helping employees understand services for screening for sleep disorders,
Mm-hmm.
because they are very common, and people are more likely to pursue that when they understand what it means, right? And understand what the symptoms might be that put them at risk. We know that, people over 50, particularly men, have a higher risk. And women too, though, and there's other risk factors as well. But the point being that by making that information available, and it might be included within your health benefits as well, that can be a really important extra kind of a opportunity that an employer can share however they share information about their medical benefits, still really considering confidentiality is to be, of course, really important there.
All right, good. So that kind of opens up my next field of questioning. It's kind of interesting, by the way. Like, it seemed like you touched a little bit on some tenets of new safety with the worker being the expert, especially on some aspects of their own sleep, and then even Amy Edmondson's psychological safety, where like I have to actually trust you that you're going to do something, even if you do create a way for me to give feedback and information. If you don't do anything, I'm going to quit participating. So, but anyway, so how to make things better? Let's break it down into two components: what actual workers can do, and then what organizations can do.
Sure. Yeah, I think that's really good. And I think there's a whole lot of tips for workers, right? For people in general. And we sometimes call that sleep hygiene.
Yeah.
And I find it really interesting in the classes that I have given that, people really are trying to seek that out. Even if they're not getting support from the employer side, they really do want to understand, because we do care about our health generally, and we do want to feel better. And so some of the really basic tips are: try to get sunlight at the beginning of your day. Now, this is a little trickier when you're working a night shift, but for the standard kind of worker, yeah, that sunlight in the morning, that natural light, it really helps our brain, understand. Okay, we're kicking off the day. It resets the melatonin that we rely on. It's released later when we are slowly getting ready to fall asleep, and it's what can get really mixed up when we flip-flop days and nights. Similarly, at the end of our day, as we're winding down, then we want to avoid bright lights. And a lot of people have heard, well, don't use your computers or get blue light filters. I think the filters and things like that make a lot of sense, but I do think we also have to think about if computer type of work or device work also though engages our brain and gets it running, right, as compared to maybe reading something. So I think,
Can I ask a follow-up question on that?
yeah.
Because I just to make sure I'm following you. You're suggesting yes, blue light filters might be good for your computer. However, even if you have a blue light filter, that computer may be triggering some kind of engagement that's going to make it harder for you to sleep soundly all night. And I'd be interested to know a little bit more about that. And then you kind of compare that to reading. And I wonder if is there some data out there that telling me that reading leads to more restful sleep than computer work?
No, I mean, thank you for asking that. I don't know if there is or not.
Okay.
So what I'm trying to get more at is imagine, think of a computer. So maybe right before I go to bed, I'm checking my work email.
Hmm. And I'm
And
stressed.
maybe it's really boring, but it could be that now there's something
Hmm.
that in fact is upsetting or now getting my brain engaged. So I'm kind of more along that line. I think there's probably lots of personal differences, but
Yeah.
what we do know is the light definitely is going to kind of trigger, you know,
Okay.
trigger that, okay, it's telling your body, okay, well, maybe it's not time to go to bed.
But I can see how reading a work email at midnight that triggers all sorts of stress about what I'm going to do tomorrow is not going to trigger, is going to hurt my sleep more than perhaps reading the book that you've written about rivers, right?
Oh, are
So,
you saying that when they read my book, they'll fall asleep?
well, in a good way, in a good way.
Yes.
It'll put me
No.
off to golden slumbers, but not out of boredom.
Yeah, no, you're right. And I think where I would really go with that is, which is really a very big tip, is, our brains are amazing. And we need to teach our brain that we're getting ready to go to bed now. That's that whole kind of adopt practices and be consistent. And I share this in my classes too, just about what we can do for our own kids if we have children, is really understanding not just the importance of sleep, but this idea around sleep hygiene.
Hmm.
And like for me, I just know I have this certain kind of way of telling my body, that it's bedtime. And for me, I read every night and I very frequently nod off to my book, and it's fallen on my head before. But the point being is everyone, other people might do different quieter activities
Hmm.
in lower light. Usually that's what we suggest. And I think that whatever those are for you, over time, that starts to help your body understand, right? That now, okay, now I get it. Now I'm slowing down. I'm going to bed, and I will sleep. And that's not going to take care of every sleep problem that's out there. And sleep insomnia is something that a lot of people, I've certainly have that, and I kind of know how I deal with it effectively because I've learned that over the time, or over time. Related to that, certainly, kind of where I started to say, kind of adopt a schedule or whatever. For me, and I'm lucky, I'm not a rotating shift worker, but I really try to go to bed and get up roughly at the same time every day, whether
Hmm.
it's a work day or not. For me, that has made such a huge difference in just how I feel and really ensuring I try really hard to get between 7 and 8 hours of sleep every night, and I can tell. So I think that it is a personal commitment we have to make because there's always something you can do, even if it's not work that's taking you away.
We,
And
you talked about waking up. You talked about going to bed, and I wonder about those times in the middle. Do you have tips for things people should be doing? After they're awake. That 12 or 16 hours, and then also any conditions that make people sleep better, like optimal temperatures, or any tips for that?
yeah, and so there are, I mean, I think what we can certainly do is list some links on your site
Yeah.
for really good sleep hygiene, because there's great lists and resources out there, and there's no way I'll get to all of them. But yeah, people, you don't want to be overheated. For a lot of people, definitely having cooler temperature. Many people say, don't do other, don't have your TV running in your bedroom. Have your bed really for just one or two purposes.
Hmm.
And that's again kind of part to that brain thing. Don't eat a heavy meal before you go to bed. Alcohol does not make you sleep better. It may make you feel like you're going to fall asleep, but as our body metabolizes those sugars, not only are we probably going to go to the bathroom more often and wake up, but those, we're going to get those wake ups. So that's definitely something that impacts negatively most people's sleep. Nicotine, heavy workouts. For most people, they kind of advise us not to go do a really big workout, an exercise routine right before bed,
Mm.
but maybe something more gentle. And there's always exceptions. I've talked to people that say, I always work out at this time, and I get home and I get ready for bed and I'm fine. And it's probably because they've kind of taught themselves
Made
that's
it.
how it works.
I can see why for many people a late night workout might not put you to sleep, but am I correct in assuming that some heightened physical activity during the day and exercise generally leads to better sleep?
Absolutely. And that's part of where we get into that catch 22 around sleep,
Hmm.
where we know that healthier habits, eating well, getting exercise, all of those do help us sleep better,
Okay.
as does, not being around high stress situations,
Right.
right?
Right.
And so the problem exists is if, let's say, we're working a shift in which, again, as we started to talk about, I'm working a lot of hours. We're not hiring more people, rather we're having people do mandatory or optional overtime. And now I've lost the time to do those health enhancing activities and the social enhancing too. And
Right.
so all I'm left with is going to work and whatever that comes with. And so it is it's a complete package, I think,
Yeah.
kind of in a way, right?
Yeah. I can see you can end up with rock meeting hard place there. Okay. So a lot of tips for individuals. What can organizations do to help individuals?
Yeah, and that's a great question. So there's a lot of things around that. First is, especially if we have so many organizations that have 24-hour people working around the clock. So, and this is the hard one, is look at your shifts. And I've had people in my classes say, yeah, we came up with these ideas and someone did a look at it, but we always come back to this is the way we've always done it. So we have to break that mindset a little bit. And I'm not saying it's easy. It can be very difficult. And yes, maybe, we do need people working at night, but there's a lot of practices and tips out there now for organizations. We know rotating shift work is the worst,
Hmm.
especially if you're doing it really frequently or
Hmm.
often. And
Hmm.
so I've heard from some organizations who, yeah, they do have multiple shifts, but they're not rotating every week like they used to, or every 2 weeks. And they're letting people acclimate to that. One organization I'm aware of that I related to a little bit earlier, that worker engagement, they really went to their workforce and said, okay, how can we do this better? And they listened to some of that response.
Hmm.
And because of, so they sometimes what happens, especially when you have night shift workers, is we want it to be fair for everybody, so everybody cycles through those shifts. And yet inevitably it might be a small percentage, but there are some people that do like night shift,
Sure.
especially if they don't have to do the shift out of it.
Right.
And so it's kind of like, we need to think about equity and fairness, but we also need to look at engagement.
Hmm.
And so shifts, it might be, there's been a number of organizations now with the data that's out there working with a sleep expert to say, should we be starting a slightly different hour than we are?
Hmm.
And what about our emergency responders? Is it better for them to work, this long or shorter? When do you call them in? And that goes well beyond what we could give advice on right here. And I would absolutely rely on our sleep researchers to really get down to some of that nitty gritty, but evaluating shifts, putting fewer people on night shift, if that works.
Hmm.
There was a lot of acclaim for the Bend Police Department recently on some of the work they did, and one of the things they realized when they evaluated is we don't need this many police officers at night like we thought we did,
Right.
right?
Hmm.
So that's the shift piece. Um, Another piece that really is big is really looking at culture and um, things like bullying and aggression, um, concerns around fairness, discrimination, respect. There has been research showing that when that is going on, either between a supervisor and an employee or within a work group, people report worse sleep.
Yeah. Yeah.
Now that's no surprise again, but we do sometimes need to be told that those things are connected. So that's again where, as we look larger at total worker health and well-being, we really see, by doing this bigger emphasis on how can we best support every employee, looking at all aspects of our health and wellness and well-being, both personal and work factors. How can we best support people? So that's a pretty big piece of it as well.
Yeah.
And then finally, I think for those workers who are working night shifts, there are definitely some tools and recommendations. Things like, encourage them at the end of the shift, to wear sunglasses if they're driving home in, daylight. If, of course, making sure they can do that safely. And there's a lot of work on lighting right now, like optimal lighting, right? And I think there's hospitals I read about this in Scandinavia that are doing this. It's more for the patients, but it's this actual changing the lighting as the day progresses.
Oh, yeah.
Right? For that patient. And, you'd have to think about, well, how does that reflect on the worker? But there's so much sophistication now, recognizing the impact of lighting, not just on mood, but on our optimal performance and sleep. And so I think that's a piece of it. And where I also one thing I want to make sure and bring up is, napping. Every class I teach, I'll ask, do any of you have napping policies, right? And, these are the things that years and years ago, early in my job, I would have been laughing that I'd be talking about happiness and napping policies. And yet it's real. And so we know that for folks, you can catch little pieces of sleep during your day that will enhance to your nights, especially those that are maybe working opposite shifts. And we know, I think many of us have heard, it's that idea of power nap. You want a shorter bite of it. You don't want to sleep for 2 hours because that tends to get into a deeper sleep that's hard to wake up from. But the advice to an organization, if they're looking at that, is set a policy. Because otherwise you're going to start to have this, right? Like, oh, so-and-so takes naps, or, not an understanding around it.
Right. Well, in your discussions, how many companies are encouraging nap time, and what kind of facilities are they putting out there to facilitate nap time?
Yeah, I think that's great. I would say it's a handful. Okay. I would not say it's,
not a lot.
Yeah. And some of them a couple that I'm aware of are very high safety demanding tasks at night. So their part of the policy is something like the person you're working with needs to know that, and how long you're gone. And, it's a real kind of elaborate, you're not just going to do it when you want to do it.
Right.
Another one, and, whether it's a special room, or I've talked to someone else who just, because they have offices, they just put a sign on their office door, or whatever their work area is. So I haven't seen anything that's real specific setting up, what your napping spot should be. I think that's probably something that's going to be just so specific to each organization. But I would, from what I've heard, I would absolutely encourage, coming up with, not a 50-page protocol on how to do it, but just, some agreements about what it means and who it applies to and why or whatever.
All right, so let's see, a lot of my notes here, a lot of talk about shift work for that, organizational culture for that. The psychological safety piece came in again, ergonomics with lighting, nap time. It's just randomly, hearkening back to something we talked about earlier, I was wondering if there's any data, any research that's shown that maybe companies that prohibit or sometimes somehow shut down access to email at night, have they seen any benefits from that? Anything on that?
It's so interesting. I haven't seen research. I've heard more about organizations that have jumped to that. I just had a question the other day about should we do that or not. There's advice from some that, there's people that want to get their emails out, like imagine a manager, and there's been, some groups who advise, well, you can get them all ready to go, but don't send them, have them go out Monday at 8, right? So, but to your question, I'm not aware of any research on it. And I think it's it's probably going to be very, very specific to the type of industry and the type of workforce. Yet we do know that there's an untold pressure on people.
Yeah.
And that's what someone just shared with me earlier this week is, this boss sends it out and says, I don't need you to look at it, sends it on a Saturday. I don't need you to look at it till Monday. But
You gotta
now
look at
it's
it.
in front of you, right? And
Yeah.
so I think it's an important question. And there have been, especially in a couple of high profile, I think it was a financial institution that did stop allowing people to access email over vacation time because they were so worried about burnout and some of the mental health kind of impact of that within their workforce.
All right, good. Okay, I know you've prepared a series of links for us. I will, when I transcribe this discussion, I'll put them in the article. But do you have any resources that you could just kind of tell people about that you recommend where they can go learn
Yeah.
more about these issues?
You bet. I'm going to have 3 particularly that you can link. I think for people who want to know about the research we're engaged in, because it really is, I find a lot of folks pretty interested in all the aspects of sleep research that's going on everywhere. But I will give you kind of right on our homepage, there's a tab about research, so folks can read about that there. Also within our homepage, there's a tab that says our resource directory, where over the years we've developed different topics, including one on sleep and shift work. And within that, you can kind of think about it exactly as what I just said, a resource directory. So there's links to things from all over the world on sleep.
Okay.
And then the final one, I think a really great resource that's linked within that directory, but I will also just put the link out there, is the Harvard Division of Sleep Medicine. And they have some just wonderful kind of tools and videos, everything from the organizational, what organizations can do to what individuals can do. There's a lot on sleep disorders. There's a terrific video of Shaq O'Neal being fitted for a CPAP and why he felt that was so important and what he gained from it. I mean, that little kind of really useful things that can be useful for both training, for safety committees, as well as individuals. So those would be certainly 3 things I'll make sure and get to you after this.
Great. And for those listening right now, when Dede's talking about the homepage, just a quick reminder, she's with the Oregon Institute of Occupational Health and Sciences. So that's the homepage we're talking about. The CPAP thing is kind of interesting. For the first time in my life, I saw one in pop culture. I was watching an Amazon TV show called Goliath, and a guy was using it, and just unusual to see that represented in popular culture now.
Yeah, that's really interesting. Yeah.
Yeah. Okay, any final words of wisdom, encouragement, or support, or cautionary tales for people out there?
No, I think what I would just kind of end with is, as much as everything I shared sounds great, I think what is really a struggle right now, and what I hear at all the training I give is, and I alluded to it, but it's organizations want to do this, or many do, but they're really caught between not having enough workers
Mm-hmm.
to cover the hours that they need covered,
Mm-hmm.
right? Or even the interest in these longer work shifts. Many workers love, or they, especially in healthcare, they love the 12-hour shift. But if you really talk to them about how much they're sleeping on some of those 12 hours, right? So it is, I think I say those last 2 things because it's to say it's very important, and we do need to work within our organizations to figure out how to be committed to it individually as well. But it's a challenge.
Yeah, it's difficult trade-offs. Ideally, we'll all win the lottery, and we won't have to worry about it.
Oh, there you go. There you go.
Well, thank you very much, Dede. How can people who are interested and want to learn more, how can they connect with you or follow you?
Yeah, thanks, Jeff. I really have always said I'm here to connect. It's what I do in my job. And so we can probably have my email address, maybe. So that's montgomd@ohsu.edu. I'm pretty easy to find. That's probably the best way to connect with me. But our institute is also represented on Twitter and Facebook and LinkedIn. So whatever way you come to us, I'm a pretty good connector. Even if you want connection with researchers, I can help get you there, or to people with different organizations as well.
And you
So
personally are on
thank you.
LinkedIn too, right? And LinkedIn
What's
and
that?
Twitter. Are you personally on LinkedIn and Twitter as well?
I am personally on LinkedIn and Twitter. So if you wanted to read one of those books.
Point taken. Okay. For everybody out there, again, a quick reminder, this is Dede Montgomery. She's industrial hygienist and a senior research associate with the Oregon Institute of Occupational Health Sciences. We will try to bring Dede back to talk about total worker health in the future, not too long, hopefully. And Dede, thank you very much for your time. We appreciate it.
Thank you. I really have enjoyed it. It's great to see you.
Good to see you as well. All right. Have a good one.
You too. Bye-bye.
Bye-bye.